Alright, so I'm making this video just to give you a quick repetition of each cranial nerve. I'm not going to talk about all the canals and branches in detail. We already did that in the previous 12 videos. This video is dedicated to basically give you one place where you will find all the schemes for each cranial nerve. So this video might be a little too long, but I promise if you know all these schemes, you basically have a good grasp of each cranial nerve. And what I recommend you is to redraw each of these schemes several times until you can recall them easier. That's what I did when I had to memorize them. Knowing these schemes will guarantee you enough knowledge on each cranial nerve. Now, before I start, I want you to understand a concept regarding the cranial nerves, a general division of the cranial nerves that will help you make sense out of how the fibers are distributed. A cranial nerve can have motor fibers, sensory fibers, or parasympathetic motor fibers. So, cranial nerves can be sensory, motor, or mixed nerves. They're called mixed nerves if they have both sensory and motor functions. Cranial nerve motor fibers are further subdivided into functional components according to their target. So they can be general somatic efferent, supplying skeletal muscles of somatic origin, like the extraocular muscles. It can be special visceral efferent, supplying skeletal muscles derived from the pharyngeal arch, like the facial muscles. And general visceral efferent fibers, giving off preganglionic fibers to ganglia that contribute to the cranial parasympathetic outflow. Postganglionic fibers of those peripheral ganglia further supply the smooth muscles and glands of various organs and salivary glands. Sensory fibers are further subdivided according to where the sensations are coming from. So it's subdivided as visceral or somatic. And visceral is further subdivided into general and special. So sensory fibers are classified as general visceral afferent fibers that convey visceral information like distension of an organ and chemical condition of blood vessels and heart and lungs and digestive system and so on. There's the special visceral afferent that carry the special sensation of taste, and general somatic afferent that bring in primarily sensations like pain and temperature and touch and vibration and pressure from the skin. And also proprioception, localized in muscles and joints and ligaments. So this is how we divide the cranial nerve fibers. Let's now start off with the olfactory nerve. The olfactory nerve conducts the sensation of smell to the brain via the olfactory bulb and tract. Here we got any sort of smell around your environment. These gaseous odorants will eventually reach your olfactory nerves at the superior part of the nasal cavity. These nerves are going to run together through the cribriform plate and then synapse with neurons in the olfactory bulb, forming those glomeruli. The olfactory bulb continues posteriorly as the olfactory tract, which is going to run towards the olfactory trigone, which is a small triangular area in front of the anterior perforated substance. The olfactory tract now divides into stria. It divides into the medial stria, the lateral stria, and in some cases the intermediate stria, which extends into the anterior perforated substance and ends in a slight elevation called the olfactory tubercle. The lateral stria terminates in the primary olfactory cortex of the temporal lobe, while the medial stria passes to the contralateral olfactory tract and terminates in the limbic structures to contribute to the emotional response brought on by the smell. Alright, so that is the general outline of this nerve. If you know this, you basically know the most important part of the olfactory nerve. Let's now do the second cranial nerve, the optic nerve. The optic nerve carries visual information to the brain via the optic tract. Our vision starts at the eyes, specifically the retina. The visual pathway consists of 4 different neurons. The first, second, and third order neurons are in the retina of the eyeball. So, first order neurons represents the rods and cones in the retina. First order means this is where light is made into nerve signals, the start of the pathway, basically. Signals then go to the second order neurons, which are the bipolar cells of the retina, then towards the third order neurons, the ganglion cells of the retina. The visual stimuli are then sent through the optic nerve, which goes through the optic canal. The optic nerve then crosses with the optic nerve of the other eye to then contribute as the optic tract. So half the fibers go to the contralateral side and half the fibers continue in the ipsilateral side, together with fibers from the other eye. The optic tract then go on and synapses with the fourth order neuron in the lateral geniculate bodies of the metathalamus. These neurons then take visual information from the retina to the primary visual cortex in the occipital lobe. There are collateral branches that go towards the midbrain as well, responsible for the pupillary light reflex, but for the sake of simplicity, since this is a summary video, we will end the scheme like this. So that was the second cranial nerve. The third cranial nerve is the oculomotor nerve. The oculomotor nerve allows the movements of the eye muscles, constriction of the pupils, and the position of the upper eyelid. Let's see how. There are two nuclei for the oculomotor nerve that are both located in the midbrain at the level of the superior colliculi. Those are called the nucleus of the oculomotor nerve and the accessory oculomotor nucleus. The oculomotor nucleus is a motor nucleus, or what we call general somatic efferent nuclei, while the accessory is indicated in purple, so it's parasympathetic, or what we call general visceral efferent nucleus. Those two nuclei are going to give off fibers that are going to meet and run together as something called the oculomotor nerve complex. It's going to go out of the midbrain through the oculomotor sulcus from the anterior side, and then run laterally in the wall of the cavernous sinus, and then enter the orbit through the superior orbital fissure into a ring called the common tendinous ring, and then it splits into the superior branch and an inferior branch. The superior branch will innervate the levator palpebra muscle and the superior rectus muscle. The inferior branch will innervate the medial rectus, inferior rectus, and the inferior oblique. The superior and the inferior branch are somatomotor fibers of the oculomotor nerve complex, meaning they innervate the extraocular muscles. The remaining fibers are parasympathetic fibers coming from the accessory oculomotor nucleus. The parasympathetic fibers run together with the inferior branch and then go out towards the ciliary ganglion. The ciliary ganglion then gives off small ciliary nerves which innervate the ciliary muscles for the accommodation, changing the shape of the lens to focus the eye on near object basically. And it innervates the sphincter pupillae, which constricts the pupil to cause miosis. Alright, so this is a general overview of the oculomotor nerve. Let's now do the fourth cranial nerve. The fourth cranial nerve is the trochlear nerve, and the trochlear nerve innervates the superior oblique muscle to move the eye in a down and out position and intort the eye. The nerve starts from a nucleus called the nucleus of the trochlear nerve. It also goes to the eye muscles, so it gives off general somatic efferent fibers. It's located in the midbrain at the level of the inferior colliculus, so inferior to the motor nucleus we talked about earlier. From the nucleus of the trochlear nerve, the motor neuron will leave from the superior surface of the midbrain, turn anteriorly, and run on the lateral wall of the cavernous sinus. It then enters the orbit via the superior orbital fissure to innervate the superior oblique. So that was this one. Next one is the trigeminal nerve. This nerve is primarily responsible for the sensory innervation of the face and motor control of the muscles involved in mastication or chewing, right? It starts with three sensory nuclei called mesencephalic, principal, and the spinal nuclei of the trigeminal nerve, and one motor nucleus, all located within the brainstem. The sensory nuclei receive general somatic afferent fibers, while the motor nucleus of the trigeminal nerve give off special visceral efferent fibers, which basically supply skeletal muscles derived from the pharyngeal arches, like the muscles of the face. Now, the way this goes is that the sensory nuclei all have a sensory root that come from the trigeminal ganglion, and there are three divisions coming in towards the trigeminal ganglion. We got the ophthalmic for the forehead and the eyes, maxillary for the region in the middle face, and the mandibular for the lower face and the jaw. The motor fibers will join the mandibular division to innervate primarily the muscles of mastication. The ophthalmic nerve will go through the superior orbital fissure, but give off a tentorial nerve before it enters, providing sensory innervation to the dura mater of the middle cranial fossa. Once the ophthalmic nerve goes through the superior orbital fissure, it receives three fibers: nasociliary, frontal, and the lacrimal nerves. The frontal nerves goes directly beneath the roof of the orbit and extends into two terminal divisions called the supraorbital nerve and the supratrochlear nerve. The supraorbital nerve goes up towards the forehead, where it splits into two of its own terminal branches, the lateral and the medial branch. The nasociliary will go through the common tendinous ring and split into the posterior ethmoidal nerves that innervate the mucosa of the ethmoidal cells and the sphenoid sinus. There's the anterior ethmoidal nerves that innervate the roof of the nasal cavity. We got the long ciliary nerves for the eyes, and the infratrochlear nerve for the upper eyelid and the conjunctiva. The last nerve is the lacrimal nerve, going towards the lacrimal gland and the upper eyelids. The maxillary nerve will go through the foramen rotundum, but before that, it will give off a meningeal branch for the dura mater in the middle cranial fossa. Once it enters the pterygopalatine fossa, it gives off 2 to 3 nerves to the pterygopalatine ganglion. Then it gives off 3 branches: the posterior superior alveolar nerve, infraorbital nerve, and the zygomatic nerve. The zygomatic and the infraorbital nerves will enter the orbital cavity through the inferior orbital fissure. The zygomatic nerve then give off 2 branches, the zygomatico-temporal branch and the zygomatico-facial branch, which both run through their own respective foramina. The infraorbital nerve will run on the floor of the orbital cavity, and on its way, it will give off the middle superior alveolar nerve and the anterior superior alveolar nerve, and then the nerve goes through the infraorbital groove and give off 3 branches. It gives off the inferior palpebral nerve, the nasal branches, and the superior labial branches for the upper lips. The third branch here is the posterior superior alveolar nerve. So that's the big part of the maxillary nerve. Other branches in respect to the pterygopalatine ganglion are the pharyngeal nerve and the nasopalatine nerve. We got the lesser palatine for the soft palate and the greater palatine for the hard palate. There are some other couple of branches here too, but I'm only going to focus on the most important ones to not make this too overwhelming. The pterygopalatine ganglion is going to give off postganglionic parasympathetic fibers that run together with the zygomatic nerve, which goes towards the lacrimal nerve as the communicant branch that provides parasympathetic innervation to the lacrimal gland. Alright, let's do V3, the mandibular. Notice how motor fibers from the motor nuclei passes below the trigeminal ganglion without synapsing with it, and then joins the sensory root of the nerve. This nerve will leave the neurocranium through the foramen ovale, and just as it leaves, it gives off the meningeal branch, which goes back up into the neurocranium through the foramen spinosum. And keep in mind, there might be variations here, but we will keep it at that. It then gives off the auriculotemporal nerve, which is composed of 2 roots that encircle the middle meningeal artery to supply the ear and the temporal region. One of the parasympathetic ganglions in our cranium is called the otic ganglion. The otic ganglion is going to receive parasympathetic fibers from the glossopharyngeal nerve, which is going to give off postganglionic parasympathetic nerve fibers that join and hitchhike along the auriculotemporal nerve to innervate the parotid gland. There is a lingual nerve, which is sensory for the anterior 2/3 of the tongue. There is the inferior alveolar nerve, which splits into the nerve of the mylohyoid muscle. The sensory part enters the mandibular foramen and reaches the mandibular canal. Within the mandibular canal, it gives off branches to supply the teeth of the mandible, hence the name inferior alveolar. The nerve then passes the mental foramen to terminate on the face and innervate the lower lips, now called the mental nerve. Then we have a buccal nerve, which innervates the skin of the cheeks and the buccal mucosa. And then we got all these muscular branches responsible for different functions, primarily mastication. So that is the scheme for the trigeminal nerve. Let's do the abducent nerve. Alright, so the abducent nerve is purely motor nerve, supplying the lateral rectus muscle involved in abduction of the eye. It starts off with the nucleus of the abducent nerve in pons, which give off motor fibers. The nerve will travel through the junction between medulla and pons. It will pierce the dura mater and travel through the cavernous sinus. Then it will go through the superior orbital fissure and the common tendinous ring, where it will innervate the lateral rectus muscle. That's really all for this one. let's now do the facial nerve. The facial nerve is responsible for providing motor innervation of the facial muscles, as well as taste from the anterior 2/3 of the tongue and producing saliva and tears. Within pons and the upper part of the medulla, we will find the motor nucleus, which sends out motor fibers or special visceral efferent fibers. We got the superior salivatory nucleus, which sends out fibers to the salivary and the lacrimal glands, where we call this general visceral efferent nuclei. Then we got some sensory fibers coming in, synapsing with the spinal nucleus of the trigeminal nerve and the nuclei of the solitary tract. These fibers go between pons and the medulla and then form two roots, a motor root and a smaller sensory root. The motor root will travel through the internal acoustic meatus and enter the facial canal. In the facial canal bends at the area where the geniculate ganglion is located. In the posterior wall of the middle ear, it will give off the nerve to stapedius, and then it will continue down towards the stylomastoid foramen. The superior salivatory nucleus will give off fibers that will also go through the geniculate ganglion without synapsing with it and give off the greater petrosal nerve. On its course towards the foramen lacerum, it merges with the deep petrosal nerve, carrying sympathetic fibers to form the nerve of the pterygoid canal. It travels to the pterygopalatine ganglion to provide preganglionic parasympathetic innervation to the lacrimal gland, as well as mucus glands of the nasal cavity, maxillary sinus, and the palate. Fibers from the superior salivary nucleus will also branch off and give a nerve called the chorda tympani. Chorda tympani exits the skull, passing through the petrotympanic fissure to enter the infratemporal fossa and terminate in the submandibular ganglion, which then sends off postganglionic fibers to innervate the submandibular and the sublingual salivary glands. Chorda tympani consists of two fibers, general visceral efferent fibers, here in purple, which come from the superior salivatory nucleus. The other component are special visceral efferent fibers coming from the taste receptors of the anterior 2/3 of the tongue, which travel to synapse with the sensory nuclei in the geniculate ganglion, which then sends fibers towards the nucleus of the solitary tract. A component of the facial nerve also provides sensory innervations around the external acoustic meatus and the retroauricular region. These general somatic afferent fibers travel through the stylomastoid foramen and also synapses with their respective nuclei in the geniculate ganglion, which then sends off fibers towards the spinal nucleus of the trigeminal nerve. The motor fibers, or special visceral efferent fibers, are going to leave the canal through the stylomastoid foramen. It then gives off the posterior auricular nerve, which branch off as the occipital and the auricular segments to innervate the occipitofrontalis muscle and the intrinsic muscles of the ear. It will also give off a stylohyoid branch and a digastric branch for their respective muscles. The facial nerve then continues into the parotid gland, branching off, forming the parotid plexus, which is a plexus of nerves that give off the superior branch and an inferior branch. The superior branch give off the temporal, zygomatic, and the buccal branches, while the inferior branch give off a marginal mandibular and the cervical branch, all supplying different muscles of the face. So that was this nerve. Now let's do the vestibulocochlear nerve. The vestibulocochlear nerve is purely a sensory nerve. It has no motor function. And it consists of two parts. The vestibular part, which is responsible for maintaining a sense of equilibrium and balance, and a cochlear part, which facilitates hearing. We will start the scheme off by adding the membranous labyrinth of the inner ear. From the cochlear part of the inner ear, there will be dendrites of nerves located within the organ of Corti, in the cochlea. These dendrites take signals towards the spiral ganglion, from where axons then run as the cochlear root. From the vestibular part of the inner ear, you will find nerve endings coming from the saccule and one coming in from the posterior ampullary crest. They too form an inferior division. Then we got a nerve coming from the macula of the utricle and two other nerves from the lateral and the anterior ampullary crest. They form the superior division. The superior and the inferior divisions will take the signals towards the vestibular ganglion. Axons from the ganglion leave as the vestibular root. The vestibular root and the cochlear root will now travel together as the vestibulocochlear nerve, and they're going to leave through the internal acoustic meatus. This nerve will now enter the brainstem through the pontomedullary junction and separate as the cochlear nerve and the vestibular nerve. The cochlear nerve will run off and synapse with the ventral and the dorsal cochlear nuclei. The vestibular nuclei will reach the vestibular nuclear complex consisting of superior, medial, lateral, and the inferior parts. The medial nucleus sends off ascending fibers to the motor nuclei of the extraocular muscles ipsilaterally and contralaterally via the medial longitudinal fasciculus, which helps facilitate the vestibulo-ocular reflex. Some fibers come from the superior nuclei as well, but for the majority of it, we associate the medial longitudinal fasciculus with the medial vestibular nucleus. The medial nucleus also give off the medial vestibulospinal tract, while the lateral nucleus give off the lateral vestibulospinal tract. The lateral vestibulospinal tract goes down ipsilaterally for the body and limb, and the medial vestibulospinal tract is a part of the medial longitudinal fasciculus, going down both ipsilaterally and contralaterally to control the head and neck movements. The inferior vestibular nucleus sends fibers towards the cerebellum through the inferior cerebellar peduncle for the vestibulocerebellar system. Fibers also come directly from the vestibular nerve before it enters the brainstem. This is a two-way connection, so fibers will also come from the cerebellum and then into the vestibular nucleus again, to help influence with the vestibulospinal tract. Then we got fibers that go all the way up to the ventral posterior group of the thalamus. These are fibers that primarily come from the superior vestibular nuclei. They then project to the internal capsule and further radiate into different areas of the cerebral cortex. It could be to the primary somatosensory cortex to map the body's location and movement signals. It could be to the frontal eye fields to control the eye movement and receive vestibular motion information. It could be to the hippocampus and the parahippocampal area for spatial orientation and navigation. Parieto-insular cortex, which responds to the body and head motion information, and towards the posterior parietal cortex as well. For the cochlear part, information is going to cross and ascend as the lateral lemniscus, but they can also go ipsilaterally and ascend. They may synapse with the superior olivary complex, which plays a role in localizing the direction of sound. Cochlear fibers may synapse with cells that lie within the lemniscus itself, which form the nucleus of the lateral lemniscus. As fibers from both sides cross, they form a mass of fibers called the trapezoid body, containing cell bodies with nuclei, which the cochlear nuclei may also synapse with. The lateral lemniscus will go up and synapse with the inferior colliculus. From here, fibers may go down as the tectospinal tract, which plays a role in the auditory reflexes. Fibers may also go up through the brachium of the inferior colliculus towards the medial geniculate body next to the thalamus. It can also receive fibers directly from the lateral lemniscus as well. Then it will radiate towards the superior temporal gyrus, which is believed to be the primary auditory cortex. So, that was the scheme for the vestibulocochlear nerve. Almost done, 9th cranial nerve. The glossopharyngeal nerve plays a crucial role in transmitting sensory information from the back of the throat, taste sensation, and saliva production, and it is involved in swallowing and speaking. This nerve has the nucleus ambiguus, inferior salivatory nucleus, which is parasympathetic, nucleus of the solitary tract, which is functionally divided into viscerosensory part and the gustatory part for taste. And we got the spinal nucleus of the trigeminal nerve, which is somatosensory. Nerves are going to go in and out through the medulla on the lateral aspect of the olive. So it has a motor component, parasympathetic component, and sensory components. The motor part will go through the jugular foramen, through the superior and the inferior ganglion of the glossopharyngeal nerve. Then it's going to go innervate the stylopharyngeus muscle. The parasympathetic component is going to go through the jugular foramen and give off the tympanic nerve. And the tympanic nerve is going to go through the tympanic canaliculus and then enter the tympanic cavity. Within the tympanic cavity is going to form the tympanic plexus, which is also formed by the sympathetic caroticotympanic nerves that extends from the internal carotid plexus. From the tympanic plexus, there is a parasympathetic branch that's going to go out called the lesser petrosal nerve. It goes through the canal of the lesser petrosal nerve and leave the cranium as it passes through the sphenopetrosal fissure, or the foramen ovale, or the petrosal foramen. There are variations to this nerve on how it exits the skull, but primarily I think most sources say the foramen ovale. But what you need to know is that this nerve will provide preganglionic parasympathetic innervation to the otic ganglion, which then form postganglionic parasympathetic fibers that run together with the auriculotemporal nerve of the trigeminal nerve to innervate the parotid gland and make it salivate. For the sensory part, there are fibers that come from the carotid body and sinus, from the baroreceptors and chemoreceptors there. They're going to take these impulses towards the inferior ganglion of the glossopharyngeal nerve and then go synapse with the nucleus of the solitary tract. Then there are some special sensory fibers for the sense of taste from the posterior 1/3 of the tongue. These fibers are going to go towards the inferior ganglion and then towards the gustation part of the solitary tract. The last fibers, which I've highlighted here in green, are somatic sensory fibers innervating mucosal membrane along different regions. There are general sensory fibers coming from the posterior 1/3 of the tongue and taking these impulses towards the cell bodies in the superior ganglion of the glossopharyngeal nerve and then towards the spinal nucleus of the trigeminal nerve. So we got two fibers now from the posterior 1/3 of the tongue, one part for taste and one part for general sensory, like touch and pain and temperature. Then there's a branch coming in along the tympanic nerve from the mucous membranes of the middle ear, tympanic membrane, and parts of the external ear. Then there's a large area in the pharyngeal region that is supplied by this nerve through the pharyngeal plexus. This plexus is formed from a union of branches from the vagus nerve, laryngopharyngeal nerves from the cervical sympathetic plexus, and the glossopharyngeal nerve. They're also going to go towards the superior ganglion and then to the spinal nucleus of the trigeminal nerve. There are also fibers coming from mucous membranes of the palatine tonsils as well. So that was this nerve. Now let's do the vagus nerve, the 10th cranial nerve. The vagus nerve has the longest course of all the cranial nerves, extending from the head to the abdomen. It has a parasympathetic component, which helps regulate functions like the heart rate, digestion, and respiratory rate. It has sensory component, relaying information from various organs, and a motor component for tasks like speech and swallowing. This nerve has altogether 4 nuclei that are located within the medulla oblongata. We got a nucleus ambiguus, posterior nucleus of the vagus nerve, which is parasympathetic, nucleus of the solitary tract, and the spinal nucleus of the trigeminal nerve. Nerves are then going to go in and out through the medulla on the lateral aspect of the olive. So it has a motor component, parasympathetic component, and a sensory component. Some important landmarks to put in here are the jugular foramen, superior ganglion of the vagus nerve, and the inferior ganglion of the vagus nerve. The first branch we will start off with is the auricular branch, which gathers sensation from the skin of the anterior auricle, external acoustic meatus, and the external surface of the tympanic membrane. The auricular branch will then go through the mastoid canalicus and then synapse with nuclei located within the superior ganglion, and then directly to the spinal nucleus of the trigeminal nerve. Another sensory nerve is the meningeal branch, which arises at the superior ganglion and re-enters the skull via the jugular foramen to innervate the dura of the posterior cranial fossa, also taking sensations towards the spinal nucleus of the trigeminal nerve. Now, from here, we're going to do a couple of branches together, since most branches of the vagus nerve consist of a combination of parasympathetic, motor, and sensory innervation. So, the motor component coming from the nucleus ambiguus will go through the jugular foramen and the ganglia without synapsing with them. Then it's going to take a turn towards the pharynx to contribute to the pharyngeal plexus, together with the glossopharyngeal and the laryngopharyngeal nerves. So the vagus nerve here represents the motor component of the pharyngeal plexus and ultimately provides motor innervations to most of the muscles of the soft palate, all but the tensor veli palatini muscle, and the pharynx, all but the stylopharyngeus muscle. Around at the level of the inferior ganglion, the cranial component of the 11th cranial nerve, the accessory nerve, is going to supply motor fibers into the vagus nerve and further towards the pharyngeal plexus, which means that the 11th cranial nerve is going to help the vagus nerve innervating most pharyngeal and soft palate muscles, both coming from parts of the nucleus ambiguus in the brainstem. Together with the pharyngeal branch, there are going to be sensory taste fibers sensing taste at around the region of the epiglottic valleculae, which are going to synapse with the nucleus within the inferior ganglion to further send information toward the nucleus of the solitary tract. So the pharyngeal branch contains sensory visceral efferent fibers, which are motor, and special visceral afferent fibers for taste. The motor fibers are going to continue and give off branches forming the superior laryngeal nerve, which also contains general visceral afferent fibers that synapse with nuclei in the inferior ganglion and then towards the nuclei of the solitary tract. The pharyngeal nerve is going to split into an external branch and an internal branch. The external branch is primarily going to innervate the cricothyroid muscle for phonation. The internal fibers are going to contain a little bit of parasympathetic fibers as well, coming in from the posterior nucleus of the vagus nerve, and they're going to provide sensory innervation to the laryngeal mucosa above the vocal cords, epiglottis and the root of the tongue, and parasympathetic innervation to glands and vasculature in the same area. Further down the line, we got the recurrent laryngeal nerve, which leaves the nerve at the region of the neck, goes down to the thorax, and loops around the subclavian artery on the right side and the aortic arch on the left side, and then they travel back up along the neck. On its way, it's going to give off branches to the trachea, providing parasympathetic fibers as well for the mucosal lining of the trachea and the mucosal glands and smooth muscles in the same area. We got the esophageal branches, which provide motor innervation to striated muscles of the esophagus, sensory innervation to the mucosa, and parasympathetic innervation to glands and smooth muscles of the esophagus. It's also going to provide motor innervation to the inferior pharyngeal constrictor muscle and a little bit of sensory innervation to the pharyngeal area as well. The recurrent laryngeal nerve are going to go up towards the larynx and terminate as the inferior laryngeal nerve. Now, the inferior laryngeal nerve has a sensory component innervating the laryngeal mucosa below the vocal cords, and a motor component innervating the intrinsic muscles of the larynx, except the cricothyroid muscle. The accessory nerve might also travel with the recurrent laryngeal to help innervate the intrinsic muscles of the larynx as well. As the inferior laryngeal nerve ascends, it's going to form some synapsing fibers with the internal branch of the superior laryngeal nerve. Alright, at this point, the rest of the fibers are going to be general visceral afferent and efferent fibers going together to various organs. So parasympathetic and sensory fibers go together. Around the heart, there are going to be a cardiac plexus, which is a mixed plexus containing parasympathetic fibers from the vagus nerve and sympathetic fibers from the sympathetic trunk. The parasympathetic, as well as some sensory innervation from the vagus nerve, come in as the superior cervical, inferior cervical, and the thoracic cardiac branches. While I did say that the nucleus ambiguus is a motor nucleus, research have shown that most parasympathetic fibers coming into the heart actually comes from the nucleus ambiguus, and to a lesser extent the posterior nucleus of the vagus nerve. So even though I put in here as though they come from the posterior nucleus of the vagus nerve, just keep in mind that most parasympathetic innervation to the heart come from the nucleus ambiguus to reduce its heart rate. Some variations also say that the cardiac branches come from the recurrent laryngeal nerve and not from the vagus nerve directly. Just keep these things in mind. There's also going to be fibers forming the pulmonary plexus, called the bronchial branches, which innervate the bronchial tree and the visceral pleura. Now, the vagus nerve is going to continue down the esophagus and form the esophageal plexus, and now penetrate the diaphragm through the esophageal hiatus, and then divide into two trunks. The left vagus nerve will form the anterior vagal trunk, and the right vagus nerve will form the posterior vagal trunk. And this is important because they innervate different structures. The anterior vagal trunk will give off the anterior gastric branches for the stomach and the hepatic branches for the liver and the lesser omentum. The posterior vagal trunk will give off the posterior gastric branches, which form the gastric plexus, together with the anterior gastric branches. And it's going to give off the celiac branches, which feed into the celiac plexus, also known as the solar plexus, which is a huge plexus within the abdominal cavity that forms secondary plexuses that supply nearly all the abdominal organs. So the parasympathetic input of the celiac plexus come from the vagus nerve. The posterior vagal trunk is also going to give off a few fibers towards the liver to innervate the liver and the gallbladder, and a few fibers towards the kidneys. So that is the general scheme of the vagus nerve. Again, keep in mind there are variations according to what source you study from. Let's now do the accessory nerve. So the accessory nerve is purely a motor nerve. It provides motor functions to the sternocleidomastoid and the trapezius, and it goes together with the vagus nerve to innervate the muscles of the pharynx, larynx, and soft palate. So it's accessory to the vagus nerve. We got two motor nuclei. Just like the glossopharyngeal and the vagus nerve, this nerve also has motor fibers coming from the nucleus ambiguus, located in the medulla oblongata. It also has the spinal accessory nuclei, which are nuclei that lie within the spinal cord, in the 6 upper segments of the spinal cord, lateral to the anterior horn of the grey matter. The nucleus ambiguus give rise to the cranial root of the accessory nerve, while the spinal accessory nucleus give rise to the spinal root of the accessory nerve. The cranial root is going to go out from the brainstem through the retroalveolar groove, while the spinal root is going to go up, enter the cranium through the foramen magnum, and fuse with the cranial root of the accessory nerve, which then form the trunk of the accessory nerve. The trunk of this nerve is then going to go through the jugular foramen and split into an internal branch and an external branch. Remember, the vagus nerve has the superior and the inferior ganglion of the vagus nerve. The accessory nerve is going to feed some motor fibers into the vagus nerve at the level of the inferior ganglion, and then go together with the pharyngeal branch to form the pharyngeal plexus and innervate the muscles of the soft palate, except the tensor vedi palatini, and muscles of the pharynx, except the stylopharyngeus. And in some variations, the nerve might also go together with the recurrent laryngeal nerve to help innervate the intrinsic muscles of the larynx. The external branch is easy. It's going to descend along the neck, grab some fibers from the anterior ramus of C2, C3, and C4 from the cervical plexus, and then go innervate the trapezius and the sternocleidomastoideus. So that is the accessory nerve. Let's now cover the hypoglossal nerve, the last of the 12 cranial nerve. The hypoglossal nerve is relatively easy. It's purely a motor nerve responsible for controlling the movement of the tongue, which means that it plays a crucial role in tongue mobility and articulation, making it essential for speech and swallowing. The hypoglossal nerve originates from the nucleus of the hypoglossal nerve, located within the medulla oblongata. This nerve is going to give off somatic efferent fibers, or motor fibers, that are going to go out from the brainstem in the sulcus between the olive and the pyramid, and then travel a short distance within the cranial cavity, and then exit the skull through the hypoglossal canal. As the nerve is now outside of the cranium, it travels between the internal carotid artery and the internal jugular vein to then form an arch we call the arch of the hypoglossal nerve. It then goes towards the tongue and give off the lingual branches to supply the muscles of the tongue, which primarily include the extrinsic muscles, the genioglossus, styloglossus, and the hyoglossus, and the intrinsic muscles, which are the superior and the inferior longitudinal lingual muscles, and the vertical and the transverse muscles of the tongue. The hypoglossal nerve is closely related with the cervical plexus, in that the anterior ramus of the first and second cervical spinal nerves are going to send some motor fibers towards the hypoglossal nerve that travel with the hypoglossal nerve to supply the geniohyoid muscle. When you study the hypoglossal nerve, you might find some variations that mention a meningeal branch coming from the sensory spinal ganglion of C2 that also travel through the hypoglossal canal and help innervate the dura mater in the floor of the posterior cranial fossa. The hypoglossal nerve will also send some motor fibers along the superior root of ansa cervicalis that go together with the inferior root of ansa cervicalis, coming from the C2 and C3 to form a nice loop called ansa cervicalis. So that is the general scheme of this nerve and its associated branches. That's it for this video. We went through all the schemes for each cranial nerve. I know it might be a lot to take in, but what helped me to memorize them while studying all the cranial nerves was to redraw all the schemes several times so that you involve some muscle memory along with cortical memory. Thank you so much for watching another one of my videos. If you enjoyed, learned something from it, please remember to like, comment your favorite moment, subscribe, turn on those notifications. If you're looking for other ways to support, go ahead and check out the link in the description box. Have fun y'all, peace.